Endometriosis is a condition in which endometrial tissue gets deposited in areas other than the endometrial lining of the uterus. The reproductive system is made up of the vagina, uterus, fallopian tubes, and ovaries. During normal menstruation, the endometrial lining of the uterus is thickened by hormones secreted by the ovaries in order to allow it to be ready to receive the fertilized egg. If the egg is not fertilized, the uterus sheds the endometrial lining into the vagina through a process known as menstruation. In the case of endometriosis, the misplaced endometrial tissue outside the uterus is also stimulated by the hormones from the ovary and thickens. This extrauterine endometrial tissue is also shed during menstruation, but cannot be eliminated from the body and is therefore trapped, resulting in inflammation and pain in the surrounding regions. This could result in adhesions or scar tissue forming between organ structures and constriction of the fallopian tube, resulting in infertility. Endometriomas or chocolate cysts could also form because of endometriosis. These are fluid-filled sacs in the ovaries, which could also cause infertility in the patient. Abnormal bleeding is another consequence of endometriosis. Common sites for endometriosis to occur include ovaries, fallopian tubes, outside of the uterus, supporting structures around the uterus, peritoneal lining of the pelvis. Other sites could also include bladder, rectum, intestines. Symptoms indicative of endometriosis are chronic progressive pain in the central pelvis, dysmenorrhea, dyspareunia, dysuria, dyschezia, abnormal bleeding, infertility. Treatment for endometriosis includes the following: use of pain medication such as acetaminophen and NSAIDs, hormonal therapy with birth control pills which prevent monthly endometrial buildup and bleeding, surgery to remove endometrial tissue, adhesions, cysts, or nerve fibers which relay pain